Hello, everyone, and welcome to our question. We're happy to have you here. This week's theme is histology. And if it's your first time joining us today, please let us know in the question box. My name is Sean. I've been with Scholar RX and RX Coach for over 2 years now, working with our coaches and students to help them accomplish their academic goals. We have Paras today. He's one of our RX coaches, and he will be leading tonight's session. Paras.
Thank you, Sean. Hey guys, my name is Paras. I'm a dermatology resident at UT Southwestern in Dallas, Texas. I originally graduated from pharmacy school in Missouri, went back home to Michigan to do medical school, and am now a resident. I have worked with USMLE-Rx as an RX coach, working one-on-one with students to help prepare them for the USMLE Step 1 and Step 2 CK as well, and I'm happy to help lead tonight's session.
So let's go ahead and begin. I've covered up those answer choices for you. The reason we do that is because we do not want the answer choices to guide or dictate the thought process. And we don't want you to see an answer choice that you are unfamiliar with that may cause you to panic as you're trying to answer the question. Once we cover up the answer choices, the next step is then to read the lead-in. The lead-in is the last sentence or the question itself. So we'll do that now. This patient most likely has which of the following disorders? This patient most likely has which of the following disorders? After that, to ask our students to let us know how many steps they believe this question will require. And the reason we do that is because we want you to have an organized thought process to make sure you're not missing anything. And the reason why we read the lead-in first is because if you read the lead-in first, when you get to the vignette, you'll already know what clues you're looking for, and that should prevent you from having to reread that question on test day. So now that the responses are coming in of how many steps this question requires, and by the way, feel free to let us know in the question box. We'll go ahead and read the vignette. A 65-year-old man comes to the physician with a 6-month history of intermittent headaches. In the past few weeks, the patient has had 2 brief episodes of vision loss in his right eye lasting approximately 10 to 15 seconds per episode. The patient had an appendectomy when he was in college and takes vitamin D supplements in the winter. On examination today, his temperature is 98.6 Fahrenheit or 37 degrees Celsius. Blood pressure is 130/80, pulse is 70, and respiratory rate is 16. A complete blood cell count shows white blood cells of 19,300, a hemoglobin of 15.5, a platelet count of 1,020,000, and a blood smear is shown. I'll give all of you a few seconds to take a look at that. And once again, this patient most likely has which of the following disorders? I want all of you to start thinking about the important clues in this vignette and in the lead-in as I hand it off to Paras.
Thank you, Sean. So we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And starting with the vignette, demographics is always the first and foremost thing that you're going to see, and it's important because it really helps you narrow your differential. What diseases are common in that age group, that gender. Sometimes they'll give you additional clues right off the bat, and that'll help as well. So we know that this patient's got some interesting signs and symptoms for 6 months, particularly headaches and vision loss. And then they give us a little bit of surgical history, medication history, and then importantly, a CBC count information. And as you can see there, some of those laboratory values we've highlighted because probably important in this case, and probably important to try to put it all together and see if you can come up with anything. They also give us a smear, okay, and that's going to be obviously very high yield, especially as Step 1 becomes more multimedia focused. It's important to recognize these images and these smears. So they're giving us a CBC or a peripheral smear. And I guess our job is to see if there's anything there that sticks out to us. So we'll get a good look at that. And then in terms of the lead-in, they're basically asking likely has which disorder, which condition. So how many steps is this question? I think you could make a case that this is a 1-step question. What's the diagnosis? 2, but I think also you could maybe argue this as a 2-step question, like 1, figuring out what is it that you're seeing on the smear, and then based off that, 2, what is a condition associated with that? So I think you can make a case that this is a two-step question. So let's take a look at those answer choices. All right, so we have 5 answer choices, and we recommend that when you go through the answer choices, you start at the bottom and work your way to the top. So we're going to start with answer choice E and work our way to answer choice A. The reason we do that is, a lot of times students will start at the top, they'll see something they like, and they select it without having gone through all the answer choices. So this way, it prevents you from biasing yourself and make sure you get through all the answer choices. So we're going to go ahead and do that now. E, primary myelofibrosis. D, polycythemia vera. C, essential thrombocythemia. B, chronic myelogenous leukemia. And A, acute promyelocytic leukemia. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the one that this patient most likely has, and we will talk about it in just a few seconds.
Excellent. Thank you, Paras. So we'll give all of you a few moments here to respond. Once again, keep in mind that all of the responses and submissions are completely anonymous, and we will wait until about 2/3 of you have responded before we move on. Remember that on test day, there is no penalty for guessing, so you should never leave a question blank. And today, if you're confused or you're unsure, just take your best guess and Paras will explain to you why the right answer is right and why the wrong answers are wrong, just here in just a little bit. All right, well, let's take a look and see what you selected. It looks like 36% of you selected polycythemia vera and 31% of you selected essential thrombocytopenia or thrombocytopenia. So let's see what the correct answer is. And the correct answer is C, and 31% of you got it right. But let's make sure you got it right for the right reasons. If you didn't get it right, don't worry. If you pay attention to Paras, you will get it right on test day. Paras.
Thank you, Sean. So yeah, definitely a tough question. Seems like we had maybe 2 or 3 answer choices we were between here. So let's look at this question again. We've got a patient with headache and visual disturbances. So that off the bat can have a lot of different causes. However, his lab values are really pointing towards like a hematologic or lymph issue. So interesting, the white blood cell count is elevated. The red blood cell count is normal, and hopefully you guys picked up that platelet count is really high, okay? So a leukocytosis alone may suggest, or an elevated white blood cell count may suggest, something like an infection, but with that really big platelet increase or thrombocytosis, especially in an older patient like this, and this is where demographics comes into play, you need to start thinking about myeloproliferative disorders, okay? And you can see there that the blood smear is kind of confirming that, and we're actually seeing some large platelets there, okay? Platelets should not be that big, and you can kind of see them between those red blood cells. There's also one kind of atypical one with those large, like, branching dendrites at like the 8 o'clock position on that picture. So this wide variation and the increase in platelets really should make you start thinking about something more bad, not something that's not benign. So malignant things you want to start thinking about include myeloproliferative disorders, myelodysplastic disorders, and even acute megaloblastic leukemia, okay? Now, then we need to figure out which of those can we rule out, okay? So we're not seeing megakaryoplasts or super big platelets, early platelets. So we can kind of rule out megaloblastic leukemia, okay? On top of that, we know that the platelets can have a weird morphology in myelodysplastic syndrome. And on top of that, myelodysplastic syndrome presents usually with penias. So leukopenia, anemia, thrombocytopenia, not what we have here. So that kind of leaves us with myeloproliferative disorders. And since any of those can manifest with thrombocytosis, answer choice C is kind of a diagnosis of exclusion here, ruling out the other answer choices as well, okay? So let's go ahead and do that. In answer choice E, primary myelofibrosis, that presents with marrow fibrosis, and thus you would have reduced cell counts of all of the above, which is the opposite of what we have here. Answer choice D, polycythemia vera. That should lead to an increase in red blood cell count and hemoglobin. We know that this patient is normal. So answer choice D is not the best answer choice, and I think that was the most highly selected one. Answer choice B, CML. This can feature a leukocytosis, which this patient has, but remember that's neutrophil rich, okay? You can also have a little bit of thrombocytosis in CML, but that kind of mirrors the elevation of white blood cell count. This patient's platelet counts are way too high for that, okay? And on top of that, the blood smear is not representative of what you'd see with CML. And then lastly, APML or APL. It's a type of acute myeloid leukemia. And in this, you can see increased white blood cell counts, but you should also see decreased hemoglobin and platelet counts, which we don't have here, okay? So this is not consistent with APML. On the next slide, Sean has actually gone ahead and included a table talking about these various myeloproliferative neoplasms, okay? And if you see there with essential thrombocythemia, massive proliferation of platelets, okay? Blood smear shows increased number of platelets, which may be abnormal. And if you look there in that table below at the bottom that Sean was highlighting, you can see there that platelets should be elevated, okay? In polycythemia vera, you can see there that it says RBCs should be increased, and then in myelofibrosis should be decreased. So you can see there that this patient's RBC count kind of ruled out polycythemia vera. So in this case, the best answer choice would have been essential thrombocythemia.
Excellent. Thank you, Paras. Great job, everyone. It was a challenging question, but it's a learning experience. So let's go ahead and move on to our second question of the evening. Once again, the answer choices are covered up. That is by design. And we will begin with the lead-in. Which of the following germ layers is the embryonic origin of these cells? Which of the following germ layers is the embryonic origin of these cells? So I'll give all of you a few moments here to let us know in the question box how many steps you think this question will require, and then we'll read the vignette. All right. I see some responses coming in, so let's go ahead and read that vignette. A 45-year-old male presents with a 1-week history of altered cognitive function and headaches. He was diagnosed with human immunodeficiency virus or HIV infection 10 years ago. His partner reports that the patient has been compliant with his treatment and has not taken any new medications recently. The circles in the slide show the cells that are activated in response to CNS damage. Which of the following germ layers is the embryonic origin of these cells? I want all of you to start thinking about the important clues in the vignette and lead in as I hand it off to Paras.
Thank you, Sean. So hopefully you're starting to see a theme to these questions, and we'll kind of go ahead and show you what we think are the important clues in the vignette and the lead-in, okay? Now, if you look at that lead-in, you could maybe even start to, when you then look at that picture, hopefully things are, maybe already starting to process in your brain. Let's go ahead and take a look at this vignette. We have a 45-year-old male with altered cognitive function, and we know he has HIV. And then they tell us that the cells that are circled are activated in response to CNS damage. So even if you weren't able to identify the cells right off the bat from that picture, the vignette did give you a very helpful clue as to the function of those cells. So important to highlight. So then let's take a look at that lead-in. Obviously, it's asking the embryonic origin of these cells. What's the germ layer? So we kind of know maybe what we're going to be working with. Let's go ahead and take a look at those answer choices. So answer choices are 5. Once again, we'll go ahead and start at the bottom and work our way up. E, surface ectoderm. D, neuroectoderm. C, neural crest. B, mesoderm. And A, endoderm. So go ahead and select the answer choice you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paris. A great question here. So we'll give all of you a few moments here to select the best response. And then as always, Paris will explain to you why the right answer is right and why the wrong ones are wrong. And that's important when you're doing questions to make sure that you look at the explanations to make sure that you got it right for the right reasons, and also look at the incorrect responses to make sure you're learning from them. And tomorrow and later on this month, we're doing a webinar with Dr. Lee, and I believe Jeff is going to put the link in the chat box. I encourage all of you to join, and you'll be able to be some of the first people to see our new format of explanations in our question bank. All right, let's see what you selected. It looks like we have a clear favorite. That's 44% of you selected mesoderm. In second place, we had neural crest. So let's see what the correct answer is. And the correct answer is indeed mesoderm, and 44% of you got it right. So great job, everybody. Let's have Paris explain it to us. Paris.
Thank you, Sean. Great job, guys. So let's take a look at this question. So this patient has an HIV-associated neurocognitive disorder. So we know that there may be some neuronal damage, okay? And those cells, you can see that they're kind of elongated, okay? The ones that are circled in blue, those are microglia. They are the resident phagocytes of the CNS, okay? And they migrate to areas of tissue damage to kind of help get rid of the damage and clear away dead and dying cells. They also release cytokines that stimulate the immune system as well, okay? Like other macrophages, microglia differentiate from the circulating blood monocytes and thus are derived from mesoderm as well, okay? Let's take a look, I think on the next slide, we actually kind of have gone ahead and told you a little bit about microglia. They're the scavenger cells, the phagocytic scavenger cells that are activated in response to tissue damage. And as you can see there, they are derived from mesoderm. You can see that they also have a role in HIV-associated dementia, which is possibly what this patient is developing. So, now that we see that where that lays in first aid, let's go back to our question and talk about the other answer choices. E, surface ectoderm. This gives rise to things like lens of the eye, the epidermis, anterior pituitary, not what we're seeing in the picture. D, neuroectoderm. This actually gives rise to a lot of CNS neurons and cells, including a lot of the glial cells, oligodendrocytes, astrocytes, ependymal cells. Those look differently though, and it's important to know how those look on histology as well, so make sure you take a look at that. Neural crest cells, answer choice C, that gives rise to several tissues of the nervous system as well, including sensory nerves, peripheral ganglia, Schwann cells, not what we have here. And then lastly, answer choice A, endoderm, kind of a little different than what we're talking about here. This is GI tract lining, respiratory tract lining, things like that. So the best answer here is mesoderm, knowing that these are microglia.
Excellent. Thank you, Paris. Great job, everyone. Strong performance there. Let's keep the momentum going. But before we get into our next question, I want to tell you a little bit about RX Coach. So you met Paris and Alex and Alec, and we talked about how they're RX coaches, and what they do is they work with students one-on-one to help them accomplish their academic goals. So there are lots of tutoring companies out there, but we are actually one of the only ones, if not the only one, that's been in medical education for almost 30 years before we started tutoring, which means we have authored our own resources and we have a lot of data, which allows us to take a data-driven approach with our students to help them bridge knowledge gaps, identify them, bridge them, and then work on test-taking skills. So the first thing we'll do is administer one of our assessments, once again, which we've authored, something unique to our company. And once you take that assessment, we'll get a baseline of exactly where you are, and we'll use that baseline to help you come up with a personalized study plan with your coach. And then we'll meet with you so you can ask your tutor questions, have things explained to you. And then your tutor for each session, depending on which subject you're working on, will create a lesson plan and curate questions in advance, which will allow you and them to work together to really identify your strengths and weaknesses, see how you think, see how you apply what you know. And so we can work on knowledge and content while simultaneously working on test-taking skills. And there are lots of review programs out there, and students oftentimes think, hey, I can do this on my own. But many of those do not address test-taking skills, and everybody does the same thing at the same time. And that cookie-cutter approach may not be what you're looking for if you want individualized attention. Our students often tell us that coming to RX Coach saved them time, they were able to take their test sooner, and they achieved or surpassed their numerical score goal on their exam. So if you're interested in working with one of our highly certified and trained coaches, please reach out to us at rx-coach.com. Click on the free consultation tab so you can talk about the program and how it can benefit you. Once again, that's rx-coach.com. You can click on the free consultation tab. You'll end up having a consultation with me, actually, and we'll talk about RX Coach and how it can help you. So once again, if you're interested, please take a look. As you can see, we have a really high student satisfaction score, and recently we had 2 of our students report their scores back, and both of them broke 250, and I think one of them will be one of our new RX coaches. So that's a great testament to the great work all of our coaches are doing. Let's go ahead and move on now to our third question of the evening and keep that momentum going. Once again, the answer choices are covered up, and we will begin with the lead-in. Which of the following is the most likely diagnosis? Which of the following is the most likely diagnosis? I'll give all of you a few moments here to let us know in the question box how many steps you think this will require. And then we'll read the lead-in. All right, I see the responses coming in. Let's go ahead and read that vignette. A 57-year-old man comes to the clinic for a regular physical exam. He is a construction worker with a 10-pack-year smoking history and drinks 5 to 6 beers per week. He notices that he often wheezes at work and has difficulty catching his breath, which began when he moved to the area 6 months ago. His exam shows occasional respiratory wheezes. The chest X-ray is normal. A micrograph of his predicted respiratory histology is shown. I'll give all of you a few seconds to take a look at that image. And once again, which of the following is the most likely diagnosis? I want all of you to start thinking about the important clues in the vignette and lead-in as I hand it off to Paris.
Thank you, Sean. So once again, we'll go ahead and show you what we think are the important clues in the vignette and the lead-in. So again, demographics, 57-year-old man. They also give us a lot of social history here, what his job is, what his drug use history is, alcohol intake, and then they tell us what symptoms he has. So all of these are important. They gave us some exam findings, and then they also told us about it. He had a chest X-ray done, and that was normal. And then again, there's another histology image, and this is a respiratory histology image. So we're going to have to kind of put our detective hat on, try to see if we can figure out if we can pick up any clues from that image. So this is a question that is asking us about a diagnosis. So I think, again, you could make the argument that this is a one-step question, figuring out what diagnosis does he have. You could also make the argument this is a two-step question, that we need to figure out first what the histologic finding is, and then based off that, what condition do you see that in? So you could make the argument this is a two-step question. So we'll go ahead and take a look at those answer choices again. And once again, we will start at the bottom and we will work our way up. Answer choice E, lobar pneumonia. D, emphysema. C, chronic bronchitis. B, bronchial asthma. And A, asbestosis. So once again, we will go ahead and open up that poll. Go ahead and select the answer choice you think is the most likely diagnosis, and we'll talk about it in just a few seconds.
Excellent, thank you, Paris. I did see a question about how long each tutoring session is. Each tutoring session is 1 hour long, and you can get more information at rx-coach.com and even click on pricing to get information on our different packages. We'll give all of you a few more moments here to select your response, and then we'll go over the correct and incorrect answer choices. As always, we do have a raffle at the end of the evening, so make sure you're present because you must be present to win. And last week, we did not have the first 2 winners present, so it would be great for you to stick around. Maybe you'll win. And it looks like 44% of you selected bronchial asthma, and in second place was asbestosis. So let's take a look and see what the correct answer is. And the correct answer is, in fact, B, bronchial asthma. And 44% of you got it right. Another strong showing. Great job, everyone. Let's hand it off to Paris.
Thank you, Sean. Yeah, great job, guys. Another nice histology question. So, what are we seeing here? Well, this patient's having episodic symptoms and classic signs of wheezing and shortness of breath. Okay, so probably, asthma is something you should be thinking about. Then we take a look at that histology slide, and what we're seeing is obstruction of that bronchial lumen. Okay, there's a lot of mucoid exudate, a lot of mucus in there. So kind of like a mucus plugging almost. Okay, and then we're also seeing, it may be a little hard to see from this low power, excuse me, but there is a little bit of hyperplasia of goblet cells, and that's what produces all that stuff within the lumen. Okay, you can kind of see it probably the best on the kind of like the bottom right from like 3 o'clock to 6 o'clock within that epithelium that's just in contact with the lumen, a lot of that clear white space in there. And then also in the top right, what you're seeing is smooth muscle hypertrophy. All of those thick bundles of stuff from like 1 o'clock to 3 o'clock, that's all smooth muscle hypertrophy. So that really should get you thinking about asthma in this situation, okay? Now, why is it not the other answer choices? Well, lobar pneumonia, you should usually have like some sort of purulent sputum filled with neutrophils, and the presentation would be like a productive cough, fever, and then also the chest x-ray here is normal, so that goes against that. And a normal chest x-ray also kind of goes against emphysema as well. And that would also be more progressive and more chronic than this patient. Answer choice C, chronic bronchitis. Again, you should be seeing a productive cough, which we don't have here. And then lastly, asbestosis. You're maybe worried a little bit with his social history, but again, you should have a dry, non-productive cough and start to see some pulmonary fibrosis, and we're not really getting that from the vignette. So the best answer choice is bronchial asthma. And on the next slide, Sean's gone ahead and pulled up a table talking about asthma as an obstructive lung disease. So that history, that presentation fits pretty good. Intermittent episodes of wheezing, shortness of breath, okay? And then pathology, hyperresponsive bronchi. You can see smooth muscle hypertrophy, which is what we saw, okay? And you can actually see kind of what they're pointing to it was actually that same image, some of that smooth muscle hypertrophy, and those arrows are kind of pointing to a lot of the mucus as well, okay? Other things that you can see in asthma include those classic Kirschmann spirals and Charcot-Leyden crystals, which you can sometimes see in asthma as well. So some important histologic findings that you can see in asthma, and hopefully these are ones that you will be able to just imprint into your memory.
Excellent. Great job, everyone. Let's keep the momentum going as we get into our last question of the evening. Once again, the answer choices are covered up, and we will begin with the lead-in. Which of the following findings is most likely to be present on this patient's peripheral blood smear? I'll give all of you a few seconds here to let us know in the question box how many steps you think this will require. I see the responses coming in from some of our veteran Q Lab attendees, so let's go ahead and read that vignette. A 16-year-old boy comes to the clinic for a sports physical. He has no complaints and appears healthy. The exam is normal. The complete blood count shows hemoglobin of 12.7, RBC count of 7 million, white blood cell count of 8,000, platelet count of 240,000, red cell distribution width or RDW is normal, mean corpuscular volume is 70, a peripheral blood smear is obtained. Which of the following findings is most likely to be present on the patient's peripheral blood smear? Once again, please start thinking about the important clues in this vignette and the lead-in as I hand it off to Paras.
Thank you, Sean. So once again, we're going to show you what we think are the important clues in the vignette and the lead-in. And the reason we do this is that hopefully you can start to pick up on what we think is important and what's necessarily not worthy of highlighting. This way, if you need to go back to the question, you'll know exactly what to focus on. And hopefully, you'll start to see just how relevant these highlighted things are in the question. So hopefully this walking through you how we think of this is helpful to you today as well. So in this vignette, just a 16-year-old boy with some blood values. So I think, the most important thing is taking a really good look at that CBC and seeing if there's anything there that we're picking up. So that's why we highlighted that. And then in terms of the lead-in, this is basically asking what finding is most likely present on the smear, okay? So I think how many steps is this question? I think I would say this is a two-step question. I think based off that CBC information, I think we may need to pick up, is there anything going on in the 16-year-old boy? And then based off that, if there's any condition, any diagnosis, disease, the second step would be, what would you see on a peripheral blood smear in this patient? So I think a two-step question here. So let's go ahead and take a look at those answer choices. And once again, we will start at the bottom and work our way up. Answer choice E, target cells. D, RBCs lacking central pallor. C, neutrophils with an increased number of nuclear lobes. B, helmet-shaped RBCs. And A, crescent-shaped RBCs. So once again, we will go ahead and open up that poll. Go ahead and select the answer that you think is the best answer, and we'll talk about it in just a few seconds.
Excellent. So let's try to finish strong here. This is our last question of the evening. Next week's topic, once again, Tuesday at 8 p.m. Eastern, will be neuroanatomy. Definitely a high yield topic that gives students a lot of trouble, so make sure you tune in. Jeff did tell you about the webinar upcoming in your chat box, so make sure you join us there. And of course, stick around to the end of the evening tonight so that you can see if you want a raffle. And we also have a special offer for all of you in attendance. So we'll give all of you a few more moments here to select an answer. All right, I see the responses coming in. Let's take a look and see what you selected. Looks like it's pretty close. 41% of you selected RBCs lacking central pallor, and 37% of you selected target cells. So let's see what the correct answer is. And the correct answer is E, target cells, and 37% of you got it right. Once again, a challenging question. Let's have Boris explain it to us now.
Thank you, Sean. Yeah, definitely another tough question here. So what are we saying in this question? Well, mainly you could see that the hemoglobin is a little mildly low for a 16-year-old boy, okay? And then the MCV, the mean corpuscular volume, is also decreased. So microcytic anemia, that's what we're going with, a microcytic anemia. The two most common causes of microcytic anemia are iron deficiency anemia and thalassemia, okay? Now, definitive diagnosis would require iron studies, a hemoglobin electrophoresis, but we can kind of come up with the presumptive diagnosis looking at those CBC studies. So we know the RBC count is increased, okay? And the RDW width is normal. And that's more consistent with thalassemia and not iron deficiency anemia, okay? In mild cases of thalassemia, the RBC count can actually be increased, which is unusual for an anemia, but you wouldn't expect that with iron deficiency anemia. Furthermore, the RDW, the red cell distribution width, that's a measure of how much variation is there between red blood cells in terms of the size. Are some red blood cells small? Are some red blood cells big? What is the width? Is there a variance in the distribution in the width of red blood cells? And in this case, it's normal, okay? In mild thalassemia, the RDW are usually similar in size, so that should be normal. However, in iron deficiency anemia, those red cells get smaller and smaller, okay? So you do start to see a difference in red blood cell size, and thus the RDW is usually increased, okay? Now, going with the diagnosis of thalassemia, the morphologic finding that you can see in thalassemia is target cells. So you have a little bit of condensation of hemoglobin in the center, and that's what gives it its targetoid appearance, okay? You can also see it in liver disease as well. So let's take a look at the other answer choices real quick, why those are incorrect. RBCs lacking central pallor is probably getting at spherocytes, and that you can see in hemolytic anemia, hereditary spherocytosis, but those are both normocytic anemias, not what we have here. C, this is getting at a megaloblastic anemia, hypersegmented neutrophils. And that would be a macrocytic anemia, usually due to B12 or folate deficiency, not what we have here. We have a microcytic anemia. Answer choice B, helmet-shaped RBCs. That you can see in things like DIC, microangiopathic hemolytic anemia, and again, not what we have here. The lab findings are not consistent with that. Answer choice A, crescent-shaped RBCs. This is seen in something like sickle cell disease, and that's typically normocytic as well. And the red blood cell count should be either normal to decreased. And then also the RDW can at times be elevated as well. So not the best answer here. And then on the next slide, Sean has actually gone ahead and pulled up a table, more so talking about the morphology of target cells, okay? So you can see it in liver disease, hepatitis C, asplenia, and especially thalassemia. And that's what's going on in this question. So the best answer there was picking up that that was thalassemia and then knowing what you would see on smear. And so another good histology question. Hopefully you guys were able to pick up on some things that we went over today.
Excellent. Thank you so much, Bara. So, you know, we want to show you one of our RX bricks. This is on general path here on tissue repair, because a lot of students oftentimes have so many resources, it kind of becomes hard to stay organized and learn in an organized way. Well, bricks will help you solve that problem. Each brick starts off with learning objectives and a case connection. Then we have these learning modules, which are very conversational. So it's informal, unlike a textbook, which is more formal. Flashcards as they come up. As you keep learning, you'll see more images and tables as relevant, more flashcards. As you continue the module and you get to the end, once again, some more great images. You can even have some images that have quizzes where you can actually just quiz yourself on the image to make sure you're taking away all the key points. Then you'll have a summary of the key take-home points from this brick. We also have practice questions, and once you select the correct answer, you will see an explanation of why it's correct and why the other ones are incorrect. As you continue going down, you'll be able to mark off these learning objectives based on your confidence with them. And then you'll be able to go deeper here in our Go Deeper section. So you can go directly into first aid. Our digital version, as you can see, 2021 has been uploaded and is active there. You can study with flash facts, which uses spaced repetition, which is a great way to learn. You can go deeper with express videos, or you can practice with our practice questions in QMax. This allows you to stay organized and prevent from having to flip resource to resource, okay? So I highly encourage you to take a look at bricks if you haven't, and Jeff will tell you a little bit later about how you can access over 150 of them absolutely free. So these are the question IDs that we covered this evening. So feel free to take a screenshot or write these numbers down. And if you have our access to our question bank already, you can simply type this into the RX search field and review these in more detail.